Ultrasound, Physical Sciences Grade 10. Animals such as birds, dolphins, and a few others can hear sounds that we as humans cannot. These animals hear sounds with very high frequency. Sounds with very high frequencies are called ultrasounds. The frequency of ultrasounds is too high for us to hear. Our ears are just not sensitive to it. There is, of course, one superhero that can hear ultrasound, Superman. But just because we cannot hear ultrasound does not mean it is not useful for us as humans. In fact, it is very useful. In medicine, ultrasound is used to create images of our insides. For example, ultrasound is commonly used during pregnancy to create an image of the fetus inside a mother's womb. In this lesson, we are going to learn more about ultrasound and its application in medicine. At the end of this lesson, I hope you will be able to describe sounds with frequencies higher than 20 kHz as ultrasounds. Explain how an image can be created using ultrasound, and describe some of the medical benefits and uses of ultrasound. Humans have a sound frequency limit. What I mean is that there are sounds with frequencies that we just cannot hear at all, unless of course you are Superman. Humans can only hear sounds with frequencies above 20 Hz. We cannot hear anything below 20 Hz. Moreover, we can only hear up to 20,000 Hz. Anything above 20,000 Hz we cannot hear. This means that we can only hear sounds with frequencies ranging between 20 Hz and 20,000 Hz. Sounds with frequencies below 20 Hz are called infrasound, and sounds with frequencies above 20,000 Hz are called ultrasound. Animals like birds and dolphins can hear ultrasound and use it to navigate their surroundings. Ultrasound for us humans is useful, especially in medicine, where it is used to create our internal images. How is ultrasound used to create images? This is a device called a transducer. A transducer is a handheld device that can make ultrasound waves. A transducer can generate sounds with very high frequencies of about 2 to 5 MHz. These are very high frequencies. This is somewhere between 2 and 5 million Hz. Usually, when a person is pregnant, they go to a clinic to take images of the baby called sonograms to examine the unborn baby using ultrasound. During an ultrasound scan, the mother is typically asked to lie on their back or perhaps their side. A gel is put on their skin where the scan will take place, and the sonographer will move the transducer on the gel. The sonographer may need to press, but this does not cause any discomfort. The transducer produces ultrasound waves which are directed internally inside the mother's womb, and these ultrasound waves are reflected at the boundaries of the different types of tissues within the mother. Let's say this is a portion of a human body. I know we are not exactly rectangular, so this is just purely for demonstration purposes. Our bodies are made of different tissues or materials such as fat and muscle. So between fat and muscle, there's a boundary. And perhaps between muscle and the deeper tissues of the body, there's another boundary. When an ultrasound is generated using the transducer, it travels all the way inside. But two things happen to these ultrasound waves when it reaches a boundary. Part of the ultrasound is transmitted through deeper and deeper. The other part of the ultrasound is reflected, and it now travels back to the transducer where it can be detected. The reflected ultrasound waves are called echoes. Different boundaries will transmit the ultrasound and reflect some of it to the transducer. Because the transducer not only produces ultrasound waves, it is also able to detect ultrasound waves. These reflected ultrasounds or echoes are used to construct an image of whatever object we want to see on the screen. In the case of a mother, they will be able to see an image of the fetus inside the mother's womb. The physics of ultrasound imaging is slightly more complex than I have described, but for grade 10 purposes, a basic explanation is enough. Before we finish, let's look at the benefits and uses of ultrasound. Ultrasound in medicine can visualize muscle and soft tissue, making them useful for scanning organs, and is commonly used during pregnancy to get sonograms. Ultrasound sources may be used to also generate heating in biological tissue. So it is also used for physical therapy and cancer treatment. There's also something called focused ultrasound sources, which are used to break up kidney stones. Ultrasonic cleaners, sometimes called supersonic cleaners, are used at frequencies from 20 to 40 kilohertz for cleaning jewelry, watches, dental instruments, surgical instruments, and industrial parts. The benefits of ultrasound is that it is safe, or it is considered a safe imaging modality. This means it does not use radiation such as X-rays. In the next couple of videos, we will learn more about X-rays, which are a form of electromagnetic radiation. Ultrasound is also widely defined as non-invasive method of looking inside the human body. This means during ultrasound, there is hardly a need to introduce a medical instrument into the body of the patient. We have learned about ultrasound, and we said that sounds with frequencies higher than 20 kilohertz are referred to as ultrasound, and sounds with frequencies lower than 20 hertz are referred to as infrasound, and that ultrasound is actually used to visualize muscle and soft tissue. The medical benefits of ultrasound is that it is a safe and a non-invasive technique, and ultrasound has a range of medical and practical application. In the next video, we will turn our attention to electromagnetic radiation.